There we are. Welcome everyone to our webinar, the Unified Platform Advancing Research Across ME/CFS, Long COVID, and Other Chronic Conditions. Hi, thank you for joining us. I'm Emily Taylor, the President and CEO here at Solve, and I'm so thrilled that you are part of this amazing conversation we're having today in this free educational webinar devoted to this exciting research. I'm going to begin by introducing our panelists. First, we have Christy Yagfield, who is a patient advocate and caregiver of individuals with neuroinflammatory disorders. She served as a volunteer, treasurer, and leader of the Dysautonomia International and Pandas Network for a combined 15 total years. She has organized fundraising events, patient seminars, clinical conferences, both in-person and virtual. She's overseen website and video content creation, staff hiring, development, accounting, business functions, and of course, policy creation and fundraising activities for all of these local speaking engagements and these organizations. Seeing a need for research that provided a more systemic, collaborative approach to infection and inflammation-driven chronic illnesses, she founded BIC. Also joining us, we have Dr. Megan Fitzgerald, who is a neuroscientist and principal investigator at the Brain Inflammation Collaborative. With a PhD in neuroscience and neurology from Weill Cornell Medical College, her doctoral research focused on adolescent neuroanatomy and the role of cannabinoid and dopamine receptors in neurodevelopmental disorders. She conducted postdoctoral work at Mount Sinai through an NIH fellowship at Columbia University, where she continued to study the neurobiology of complex conditions and focused on the promise of regenerative medicine in the neurostem cells in treatment of these disorders. When she became ill with COVID and subsequently long COVID in March 2020, she shifted her research focus to infection-associated chronic conditions such as long COVID and ME, and has worked extensively with the Patient-Led Research Collaborative, the PLRC, co-leading a study on COVID-19 reinfections, amongst other work. Dr. Fitzgerald is also a representative for the NIH Recover Initiative, contributing to research and the long-term impacts of long COVID on children's health. Specifically, at the Brain Inflammation Collaborative, Dr. Fitzgerald leads the Unhide study, a digital health platform aimed at improving diagnosis, study, and treatment of neuroinflammatory conditions, including long COVID, ME, Lyme disease, PANS, multiple sclerosis, and many more, specifically in children and teenagers, an area of high need. She is actively involved in the collaborative efforts with multiple scientists, clinicians, and patient advocacy organizations to develop a comprehensive, patient-centered approach to research. Thank you, Dr. Fitzgerald. And last but not least, we have Chris Nowak, who worked at a healthcare technology for 12 years and is the lead architect for the Care Evolution My Data Helps digital research platform. In addition to all of that amazing work, his wife Amber has ME/CFS, and together they created Symptom Shark, a digital symptom diary to help patients monitor their symptoms over time. These features that were brought to platforms like Unhide and Solve Together. Chris also works with many other research initiatives supported by My Data Helps, including long COVID treatment trials by Scripps Research and the NIH. He focuses on building digital tools for patients that can improve the speed, diversity, and robustness of clinical research. Thank you all so much, and really appreciate you joining us and your collaboration on this unified platform. Before we get started, I'd like to share a little bit about the journey that brought us to this amazing scientific moment. As many of you know, since 2010, Solve ME/CFS Initiative, or Solve, has collected patient-reported data through our biobank, then through our You and Me platform, and most recently through Solve Together, a dynamic platform created by Care Evolution. It allows users to track symptoms, sync wearables, generate reports for providers, opt into clinical studies. It's the largest database of its kind in the United States. But before we dive into the platform, it's good to talk about where we started. And we started as the You and Me registry. This is a really important moment that I want to share because it really talks about the goals that drive all of this work. First, patient-centered, because patients should always come first. Second, the integration. When we looked at the pipeline of where drugs are coming from and where those gaps are for ME/CFS, we wanted to integrate a platform that filled those gaps, that lowered the cost of clinical trials, that integrated data and prevented that from being a barrier in future science. And lastly, we wanted it to be research-driven so that it was ultimately bringing these outcomes from bench to bedside as quickly as possible. And lastly, these integrations had to make sure that severe patients were included. Next slide, please. Megan will dive a little bit deeper into a lot of these points, but I wanted to focus on why this tool was meant to be easy for patients to access and use. All of our projects and purpose and work in this area was designed so that it was not prohibitive for patients, especially severe patients, to get involved. Again, lowering the entry and barrier for participation was key. So in order to do this, we really relied on a lot of our community feedback. And so I really want to take this moment to pause and say thank you to the Lived Experience Task Force, our Community Advisory Council, all the beta testers who provided, and members of our community who provided input and feedback on this process. A huge thanks to everybody who made this tool as patient-friendly as possible. And all of this leads to the next evolution, solve together. And that's the next slide, please. I am so proud of this platform, and I am so proud of the partnership that enabled BIC to take this on to the next level. This has truly been an exercise in collaboration, and all of these amazing integration elements are going to be built upon and even stronger in this next iteration. So looking at things like patient-reported outcomes, a critical piece that are now being validated by our government partners, electronic health record integration, a key challenge and a key barrier that we're so proud to have been successful in working towards, wearable and activity tracking data, and of course, integrating patients with severe diseases so that we're not just getting folks who are well enough to go to doctor's offices, but also getting patients to participate who are too sick to do so outside of their home. So last but not least, I just want to note that we're standing on the shoulders of giants. The proof is in the pudding. These are some examples of some of the previous science that have already come out of this great work, and we're excited to have even more coming in the future. And that's what we're here to talk about today. So just a quick look at some of the work that we're so proud to have enabled, including some of this, the hydrogen water study, changes in gut microbiome, some of these symptom management and patient impairments through the wearables, really great opportunities. And again, we have so many more that we have to go. So with that, I'd love to turn it over to Christy to talk a little bit about the partnership that led to the unified platform and where the unified platform is going from here. So thank you all so much for letting me walk down memory lane and how we got here. And now let's talk about where we're going.
Thank you so much, Emily, for this opportunity to take part in this webinar today. I'm really excited to share more about the platform and to highlight some of the additions that we've already made and those that are yet to come. I will be talking about collaboration and partnership with other organizations and including underrepresented communities who will make this a sustainable project. Next slide. This is a picture of my youngest, the summer before her whole world fell apart. She turned 11 that year, and I can only say that she had a gregarious personality and loved being at the center of it all. And it was really devastating as she experienced unexplained behavioral changes and physical symptoms that often left her unable to participate in life, leaving behind friends and fun she couldn't get enough of. But there were many signs in those first 11 years, signs that together in the hands of a knowledgeable clinician could have changed our path or at least made it a more educated and less scary one. And honestly, without Google, I don't know what we would have done as a family. I co-founded the Brain Inflammation Collaborative because although I loved all of the advocacy work that I was already doing, I was frustrated with the lack of collaboration between organizations and the responses from people in general on how little they knew about chronic illness. I also knew there were too many barriers to research, and the infection-driven illness space, progress wasn't happening quickly enough. I still talk weekly to families that share a story similar to what we lived through 15 years ago. So we developed unhide, a digital health platform available by app or web browser designed to bring patients and researchers together. We built the platform to enhance the Solve Together platform already created by SolveME, and you'll hear both Megan and Chris talk more about how it was built, how it works, and some of the statistics we already have been able to use. We wanted to find a way to start looking at these overlapping illnesses and find treatments that could not help one illness model, but many. COVID has definitely accelerated that, as it brought Zoom calls and the possibility of collaborating around the world that much easier. And it helped to push forward this concept of chronic illnesses and sometimes mental health symptoms being triggered by common infections. And as a parent of someone with chronic illness, I needed a way to help others as an outlet for me. I needed something I could act on, and I hear that often from caregivers. What can I do? And our platform can be a place for that. It can empower caregivers, it can empower patients, it can promote advocacy, it can educate, and it provides a link to actionable research that so many want to take part in as participants or caregivers, but previously didn't have a place to. You can literally do it from anywhere in the US. We hope to include international someday with additional funding, but for now it's only in the US. The patient and the caregiver community in the chronic illness and mental health world are highly motivated, but many aren't sure where to channel that urgent need they feel to do something to help. But I do want to stress, as Emily mentioned, not all participants or caregivers are in the same place. You can simply track symptoms and do what you are able and as you are able. The platform is meant to fit the needs of many. So that's why the Brain Inflammation Collaborative was started, and a little about what we do. Next slide. Some of the additions we have made to the platform include the pediatric population, which is also an underrepresented population. This was launched yesterday and includes patients as young as 2. And I'll talk a little bit more about that in a minute. And at the end of the webinar, there'll be information on how to get signed up. We've also added the inclusion of mental health surveys and how neuroinflammation impacts this. This is something that is very underrepresented in research. Better treatments will come with a better understanding of the role of inflammation and mental health symptoms. We will be adding Spanish language access sometime in November so that participants who primarily speak Spanish can more easily enroll, navigate the platform, and use its tools. It's a great place to start, and we hope to add additional languages in the future as funding and resources allow. We also look to include those often excluded from research, including minorities and those unable to travel to research sites. They can now participate from home. Patients who are too sick, caregivers with emotional strains of running a household, those without financial resources, or in rural areas too far from research sites, or even those who don't know that this research exists because they aren't in the many targeted social media channels that share these types of projects. We need to do better to find ways to include greater diversity in research. Next slide. Making research accessible. Research has been siloed. I think we all know that and we hear that phrase often, but how do we change it? Intentionally partnering with advocacy groups, academia, and other foundations is vital to our mission. Everyone plays a role in contributing and taking on such a heavy lift. We wanted to centralize research in the neuroinflammatory space with an open access format. Researchers and participants can see what research we have going on and then build on it. A researcher can use existing data or recruit a cohort to add to what's already there. I think it's important to stress that we need to work together, recreating tools and platforms. This is something that's a real issue in this space, and we see it over and over. We need to better utilize the existing tools when the dollars in this space are so difficult to come by. This is also why we wanted to work with Solve ME. When we realized how similar our platforms were, it only made sense to combine them and work together, not to create another tool that adds to the noise in an already crowded space. And as a nonprofit, all data remains owned completely by the participant. It is only used in a de-identified fashion for research, and we never sell any of the data. And using the app or the web browser, it's free for all participants to use in its entirety. We wanted to make sure that that wasn't a barrier. We also wanted to make sure that we were helping to reduce common barriers to research, that we could provide a place that helps the researcher navigate and get IRB approval where needed, to provide consents and assents, a place to collect the data itself, help them with recruitment if needed, and then provide the researcher with the data in an organized fashion. All these things require resources and come at a cost. The centralized research of 30+ neuroinflammatory illnesses also allows for a cross-sectional lens to overlapping illnesses, especially when participants often have multiple comorbidities, with potential treatments helping many. Again, I want to emphasize that with few dollars in this space, the importance of working together has never been greater. Next slide. This takes the pediatric piece a step further, something that we feel very strongly about. Teens and adolescent voices have been left out of the narrative for too long. Barriers to inclusion are high. Regulatory requirements for including children in research are complicated and require those with expertise. We wanted to make sure we could provide, again, a place for researchers to collect real-world data without that as a barrier. Adults that have long histories of unexplained symptoms, like my daughter, like my husband, how do we get that missing history documented so that we can diagnose earlier or identify those at risk? How do we educate society about chronic illness, just like we do about cancer or diabetes or heart disease? It should be discussed early on with pediatricians and family practitioners for everyone. And when there are symptoms that don't make sense, or your family history indicates a genetic predisposition, more discussion is needed. We need to learn how these illnesses progress and provide a roadmap for clinicians, for not only things to watch for, but for treatment protocols. Clinicians are often at a loss to prescribe off-label in the chronic illness world because it's out of their comfort zone. Again, as I mentioned before, this gives the caregiver an actionable outlet. Caregivers are often, they feel helpless and they want to help those who come after them. And this can apply to the participants and the patients as well. Next slide. I encourage advocacy groups to reach out to us, partner with us to make the research happen, partner with us to demonstrate that neuroinflammation is not a fringe theory, but a foundational principle in understanding mental and physical health. Through joint programs, educational campaigns, and co-authored publications, we can make progress in changing how people learn about and view chronic illness. We can identify research gaps. Advocacy groups have insight into what patients and families struggle with every day. This can help direct research to the areas of greatest need, filling the gaps left by traditional studies. Raise public awareness. By working together, we can drive a more informed public conversation. Whether through media events, public health initiatives, advocacy groups are in a unique position to help raise awareness of brain inflammation and to reduce that stigma. Together, we can transform the way we understand mental and physical health and its connection to brain inflammation, replacing outdated frameworks with new tools, updated data, and renewed hope. We strive together to amplify unheard voices and reimagine what is possible for the millions affected by brain inflammation-related disorders. Next slide. And thank you. Thank you again, Emily and Solve, for hosting this great webinar. It means a lot to finally see this launched, and we're so appreciative to have the Solve team there with us and to help promote this and get the word out there. I will now pass the torch to Dr. Megan Fitzgerald, who will share how we're expanding these capabilities.
Okay, here we go. Thank you so much, Christy. Christy did an amazing job for explaining about why we are so excited and motivated to do this work in pediatrics. And just wanted to say our pediatric side of Unhide just went live yesterday. So if I sound a little tired, a little bit under the weather, we've been working so hard together to make sure that that was off the ground before we were talking about it today. And we're really excited about it. So today I'm going to be speaking about two things. First is that pediatric launch, and the second is some preliminary results and data and insights for a survey that we've launched in the platform in adults called What Helped, What Didn't. So I wanted to start with talking about how infection-associated chronic conditions like long COVID and ME impact children and teenagers. there are these two quotes from this recent qualitative research paper that came out actually 2023 that just really resonated with me and I wanted to share. The first is, I don't really dare to have dreams anymore. Now that I have long COVID, my first goal or dream is to get better. And that was by a 17-year-old girl. The second quote was, on what he wishes for but cannot do. Be with friends a lot, because I can't manage. If I can manage that day, the day after, I get really, really tired and can barely do anything at all. For those of us who experience post-exertional malaise, for those of us living with long COVID or ME, I think that these quotes just really resonate. And it's just really important to understand that children and teenagers are affected by ME, CFS, long COVID, and other related conditions. It's frustrating because I feel like early in, particularly in the COVID pandemic, there was this rumor going around that kids are not affected by COVID. And of course it's false. Like, that doesn't even make any scientific sense. But the truth is that their symptom presentation, particularly in long COVID, might differ from adults. And this holds true for ME as well. And because the symptom presentation might differ, it can lead to missed or delayed diagnoses in children. And then these underdiagnosis and the frequent exclusion of children and teens from long COVID and ME CFS studies can lead to feelings of isolation that these children and teenagers experience alongside their families, as Christy alluded to, as well as poor care outcomes. One of the things that is commonly said in pediatric research is that children are not just small adults. And that bears repeating, because their immune systems, their neurological systems, their entire bodies and minds are still developing. And so the manifestation of these conditions is different. Nonetheless, long COVID is slated to be one of the most common chronic health conditions in children. And I'm stating that based on the data that's coming out of the longitudinal RECOVER cohort, where the estimates for the amount of children who may develop long COVID are surpassing that of asthma, which is the current most common chronic health condition in children in the United States. What's important about what we're building here with unhide is that it allows researchers to better understand how these infection-associated chronic conditions change over development. Because children aren't just small adults, they go through these really distinct phases in development, from infancy to toddlerhood, childhood, and then through all of the changes that happen around adolescence and puberty, where a lot of hormones come on board, and then the transition eventually to adulthood. What's so important and what's so unique about how we designed unhide is that it allows for fairly low burden longitudinal data collection that is going to be extremely precious to the research community in hoping to better understand how these conditions impact children and teenagers as well as their family. In addition to that, we have other diagnoses that we're recruiting for with unhide, and this is going to allow for comparisons between conditions such as long COVID and then other infection-associated chronic conditions like PANS and PANDAS, which can frequently arise, or infrequently, thankfully, but is most frequently triggered by a strep infection in some children, and Lyme disease, which can have long-term effects, as well as ME/CFS. And there are other neuroinflammatory and developmental disorders that we're including as well. Now, the development of the pediatric platform doesn't only require complex hoops in terms of regulatory requirements to jump through, but also we had to thoughtfully think about which surveys and which validated survey tools we were going to include. There are some that we had in the adult platform that we were able to recapitulate fairly painlessly in the pediatric platform, like the GAD-7 and COMPASS 31, as well as the Baton questionnaire. There are others like the FunCap 27 and the SF36 that are not appropriate for children. And so we had to look for alternatives and try to figure out an appropriate cadence. As well, we also added a caregiver strain index, which is for parents to try to assess the toll that having a child with one of these conditions is taking on the entire family, because that is all too frequently the case. So these are the standardized survey tools that are in both the adult and the pediatric platform, as well as the cadence at which they appear. I know it seems like a lot. Chris is going to walk you through later how we try to make these survey instruments as manageable as they can be for our participants. In addition to those standardized survey tools, we have a number of surveys that we've developed on our own at BIC, as well as with collaborators, that are going to be launching imminently, and some which have already launched. The characterizing brain fog study is for adults as well as children and their families or caregivers. And that was developed in collaboration with Lyme disease researcher Dr. Mara Kubaldina from Columbia University. Dr. Jenny Frankovich has been working with us on a medications of special interest survey for PANS and PANDAS. We're estimating that launch on or before January of 2026. We have additionally recently spoken to a lot of parents and caregivers, and together have developed a mood and behavioral survey that will be coming very soon and should be showing up imminently for those who are using the platform, as well as a what helped, what didn't survey, which launched in August. Now that's what I'm going to be discussing for the rest of my time here. I'd like to show some preliminary results from that study. Now, most of the participants who are in the unhide platform currently had enrolled with us or with Solve Together, and the majority of the conditions are long COVID and ME. So that's the population who took the survey thus far. I want to keep in mind that this is preliminary data. It is going to change as more people take the survey and as we get deeper into the analysis. However, I did want to share it sooner rather than later, because it is the case that data can languish for a while without being analyzed. And to me, as Emily mentioned in the intro, I'm also a patient. I'm not just a researcher with this condition. And this is something that I think is just really important to get out into the community and disseminate as quickly as we can. So here's an overview of the survey. It's just 6 questions, takes about 10 minutes. And the 6 questions are: what treatments have helped you the most with your symptoms, daily life, and overall health? What treatments have helped somewhat with your symptoms, daily life, and overall health? Are there any treatments that worked when you started taking them but then stopped working? Which treatments had no effect on your symptoms, daily life, or overall health? Which treatments worsened your symptoms, quality of life, or overall health? And then finally, please list any treatments that you had to discontinue due to side effects, even if the treatment helped certain symptoms. The 2 that I'm going to focus on that are hot off the presses in terms of data analysis are the first question and the 5th question: the treatments that have helped the most and the treatments that have worsened symptoms. So this first graph shows which treatments have helped the most with symptoms, daily life, and overall health. This is all of the treatments that were reported, so this is not just medication. You can see up top here, it's pacing, followed by supplements, LDN, that's low-dose naltrexone, diet, rest, antihistamines, antidepressants, stimulants, electrolytes, and exercises. So for a number of these, the antihistamines, antidepressants, for example, it would combine a number of individual drugs that fell into that class of drugs. And I think it's no big surprise to anyone that pacing is probably at the top of that chart. We had almost 500 people as of Friday who had answered the survey, 499. And between those 499 participants, they reported 2,009 different treatments for this first question of what treatments have helped you the most with your daily symptoms. So I just want to say thank you. If any of you listening today have responded to this survey, we really appreciate your participating in this research. Now, taking out some of the more interventions here and just focusing on medications, the medications that helped the most were LDN, antihistamines, antidepressants, stimulants, beta blockers, sedatives, magnesium, migraine medications, cannabis, and mestinon. So these are just the medications. And again, I think a lot of these are not too surprising that LDN is kind of at the top of the list here. It is one that a lot of us get some help with. I would say that, mestinon reaching the top 10 and magnesium being so high up as a supplement that helped so many people was a bit surprising and encouraging, because I think magnesium has it's very accessible to people to take. Now, looking at the flip side, what treatments worsened your symptoms, your quality of life, or your overall health? I don't think it's anyone's surprise living with this condition that exercise tops the list of this. Now, this encompassed a number of types of exercise, from GET to people feeling like they push themselves too hard doing their own cardiovascular training, or just push themselves too hard doing physical exercise. Following exercise is antidepressants, stimulants, supplements, antihistamines, a variety of diets, hormonal therapies, and then mestinons here again, beta blockers, and gabapentin. Now for this one again, we had 499 participants in the survey, but only 618 damaging treatments were reported. So similarly, taking away the interventional treatments and looking only at the medications, at the top of the list of what treatments have worsened symptoms or quality of life, there's antidepressants, stimulants, antihistamines, hormonal therapies, mestinon, beta blockers, gabapentin, sedatives, DMARDs, and LDN. Now, for DMARDs and LDN, there was about 10 participants who were reporting adverse effects from various DMARDs, which are disease-modifying antirheumatic drugs, and LDN had about 9 participants reporting adverse events. To put this all side by side, the very effective treatments compared to damaging treatments, we have pacing at the top of the list of very effective treatments and exercise at the top of the damaging treatments. And you can see there's a couple of things, unfortunately, that are on both the list of very effective treatments as well as damaging treatments. Now, I wanted to circle these because, I felt like these are probably, even though they're on both lists, they're probably very high risk for people to try, particularly with exercise, which is the number one most commonly reported treatment that induce long-term harm. But antidepressants and stimulants are also fairly, even though they make the very effective treatments, they're also pretty high on the treatments that people reported as having damaging effects. Whereas on the flip side, pacing and LDN, or low-dose naltrexone, made the list of the top 10 very effective treatments. And again, I want to emphasize that this is the top 10 for each of these categories. There were many more reported. A lot of them fell into kind of an other category if they didn't have, not many people reported the same treatment. So we'll continue getting more into depth with that analysis also. But for now, the ones that are topping the list, I think, of very effective treatments without appearing on the list, the top 10 of damaging treatments are pacing and LDN. Now, LDN, as I had mentioned, there are some people who did report that this was damaging in terms of looking at the medication alone. But again, we have antidepressants and stimulants that are kind of at the top of the list of damaging treatments that people have self-reported here. So I wanted to just speak briefly about the future directions of this work. We're going to analyze the additional questions that are in the survey, like the side effects, what worked and then didn't work, treatments that helped somewhat, treatments that had no effect, as well as the open answer. And then we'd like to take a look at what works for whom. Is there a diagnosis, a certain demographic? Like, for example, would one treatment work better for men or for women? Or is there a symptom cluster that might predict a good versus a poor treatment response? I think that this would be valuable to look at, even if it was, just try to figure out who's going to respond poorly to a certain treatment, so that they could know to avoid that. We'd like to compare treatment response with reported comorbidities. As Christy was alluding to, a lot of participants have multiple comorbidities, and we'll talk about this a bit more at the IACFS ME conference later this month. But this analysis would be really valuable to do as well. And then we're adding the pediatrics to circle back to what we were speaking to in the beginning of this talk. Pediatrics will be added to this data set as well. We're definitely looking for collaborators funding opportunities, if people have experience working with these very big data sets. You know, we're a small but hardworking team here at BIC, and we're doing a lot right now. So we're definitely open to collaboration and sharing this work. And just, we really do have a treasure trove of data that we'd like to dig into. And with that, I can pass it to Chris. I think I've spoken more about how the platform can benefit us all as a research, scientific, and patient community, and he's going to speak to how this platform can also be used to benefit you as an individual patient.
Fantastic. Thank you, Emily, Megan, and Christy, for all the kind of fantastic information on the background of the platform. So I'm not sure if we've been explicit, but I want to make sure everyone knows that the platform is available to enroll in now, assuming you are over 2 years old and in the United States, I think is the eligibility criteria. So yes, it's open today, and we in fact encourage you to enroll. And yeah, my job, I think I'm just going to go through kind of what it actually looks like to participate, and what kinds of things being a participant gets you access to. So very briefly, maybe just to start, how you join is really straightforward. You can participate using a web browser, either on your desktop computer or your phone. You know, just visit unhidenow.org. You can sign up by clicking the sign up button. You'll kind of just get introduced to the platform. It'll ask you some questions like date of birth to determine, you know, what kind of consent you need to sign if you're a pediatric or adult participant. And then you'll be asked to create an account. But the whole process is very straightforward and simple. Once you create your account, we encourage you to actually download the app. So if you happen to be participating on a smartphone, you can download the My Data Helps app either on iPhone or Android devices, and that makes participation easier, especially if you want to participate in symptom logging, which I'll show here in 1 second. So maybe jumping right into kind of what it looks like. So this is me. I'm set up on the app today, and you know, I've already kind of jumped ahead a few steps because it takes a while to get things set up, but to kind of show what the app looks like for someone who's kind of already joined unhide. And so I've actually, you can see I've got a button to kind of log symptoms. You'll see some data already coming in. I've got my Fitbit hooked up today, showing some of my device activity, and you know, I've got air quality kind of showing up here as well. I've got some surveys that I can answer, health records that I can connect, and of course some, you know, we've got some helpful resources embedded from the Brain Inflammation Collaborative, and you of course at any time using the platform can email the platform support using the link here as well. Maybe just to start, as kind of Megan mentioned, one of the important aspects of the platform, you know, as soon as you join the platform, you'll be prompted with a series of surveys on important research questions, you know, things that Megan mentioned, including, you know, the kind of what helped, what didn't survey, you know, your background, medical conditions, illness history. And maybe super important thing to note here is that you can absolutely go at your own pace. Do not feel like, you know, once you join the platform, you need to complete all of the surveys in one sitting. And in fact, if I start one of the surveys, if you go into and say, you know, you get started with your medical condition survey, and you know, you decide that halfway through you don't want to complete it, don't worry, your progress is always saved, however far you happen to get in the survey. So, you know, you can always save your results for later and pick up exactly where you left off. So again, wanted to make sure we kind of optimize the survey taking experience for people who might be experiencing brain fog or may not have the energy to complete a lot of surveys in one sitting. So another aspect of the platform, as I mentioned, wearing my Fitbit today, is the platform enables you to connect to any of your devices, whether that's a wearable device or even kind of sharing data from your phone. So I happen to have connected my Fitbit, but you can also connect to, if you happen to have a Garmin or a Ring, or any of your Apple Health wearables, such as Apple Watch or, a Withings watch. And you'll start to see data coming into the platform. And I'll show in a little bit some of the cool features that connecting a wearable can unlock for you. But if you happen to be on an Android device as well, you'll have the option to connect to Google Fit or Android Health Connect. Connecting to your health records from your provider or health plan are also a kind of valuable source of data. And if you happen to be going, especially to more than one provider, the unhide platform allows you to actually connect and organize all of your health records in one place. So here, it's a pretty straightforward process. If you want to, let's say I happen to be going to Cedars-Sinai Health System, say I'm a patient there, I can actually connect to my patient portal health records by entering by connecting to my patient portal account at my health system. And I can grant access to share my data with unhide, and I can even choose what types of data I want to share and for how long. And once I do this, I can actually, in unhide, view all of the various health record data that has been collected. And so, if you happen to be, like I know my wife has traveled across the country to see various specialists, and this enables you to connect to all of those providers and kind of see all of that data in one place. So, I can look at my lab results and say if I want to search for specific results, it also enables you to kind of a nice view of that data. Now, one of the core features as well is the ability to quickly and easily track and log your symptoms on a daily basis. So, one of the key goals in the symptom log is the ability to take only a few seconds to log your symptoms on a daily basis. So we've made it extremely easy. And in fact, the symptoms and treatments that you see here that I have when I choose to log my symptoms are entirely customizable. So it's really your symptom log, and it's really about what is most helpful to you on a daily basis. So if I go to more here, I can actually go and choose. Let's say I want to track migraine headaches. I can actually add migraine as a symptom and save that. And I can now log migraine as a symptom if I choose. But let's say today I'm experiencing moderate fatigue and mild brain fog, and say I've tried using caffeine today, and maybe I'm feeling okay overall. And I've now logged just takes a couple seconds to log my data today. But once I start to do this, I can start to really see the data come together. You can actually start to see patterns in your data, or this could be really useful for preparing for doctor's appointments, or when you're at a doctor's appointment. I think, speaking from personal experience, and I think the anecdotes we hear most often for people using the symptom log is they'll be at a doctor's appointment, they'll be asked, how many times did you have, say, a migraine or fatigue in the last month? And, being able to look at your calendar and easily makes it easy to answer, answer a lot of those questions, so that hopefully it makes the doctor interaction a lot easier. You can also get these symptom logs as a downloadable PDF that you can actually then share directly with your doctor. So I can create a report for September here. And this actually generates a PDF report. So I could, print this or share it directly with via email with my provider or caregiver or whoever I want to. And pulling this all together a little bit, I think I had mentioned, some things that connecting a wearable unlocks. So there is this third tab is called the activity tab, and this lets you kind of view a lot of your wearable data over time, and kind of lets you see, when have I had maybe spikes of activity or, say, poor sleep, as well as viewing, what is my heart rate today, alongside whatever symptoms that I happen to have logged as well. So, in this case, for instance, I can see, on the 12th, I had, I think I was unpacking for vacation. I had a really high number of steps for me, relatively speaking, and I can kind of see maybe what symptoms that resulted in for me. So, and I think finally, the last thing I wanted to highlight was this concept of pacing notifications. So in the we have the ability, once you've connected to either either available for Fitbit or Apple Health devices. So once you connect to one of those, you can enable, you can choose to enable pacing notifications, and these will essentially monitor, your steps and heart rate throughout the day. And if you choose to, say, enable notifications for steps, it'll send you notifications based on, oh, here it is. How many steps you've walked relative to, say, your recent average. So, an example would be if you walked 75% of your recent average steps, or 100%, or 125%. So, once you receive those notifications, you can choose to, decide if you want to pace yourself. Similarly, if your heart rate has been over 113 beats per minute for 9 minutes, you can kind of, there's a lot of people who happen to be using wearables for pacing, and we hope that this kind of feature makes it a little bit easier to kind of stay on top of maybe how much you might be exerting yourself on any given day. So yeah, I think maybe stepping back, I think just wanted to highlight some of the features that are available once you start participating in the platform. I think our goal is that it's not just, something that you participate in that powers all of those cool research insights that, Megan and Christy were talking about. Obviously, that's incredibly important, but also, we want to make sure that anyone who participates in Unhide gets some value out of it themselves, and they can, hopefully get insights themselves about their own health as they continue to participate. I think that's all I have. So.
Fantastic. Thank you so much, Chris. And thank you, Megan and Christy. This was a fantastic presentation. I hope that gave everyone as quick of a picture as we could provide in 35 minutes of what this platform is capable of, and the amazing service it can offer for both you and your loved ones, and also for research. So again, the platform is available. There's a QR code on your screen now. If you are interested in getting involved, if your age is 2 to 100, you're welcome. And your either through the app or through the web platform, your data can both be used for yourself and for research. So with that, we've had so many questions coming in. Oh my goodness, I'm going to try to get to as many as possible in the time we have left. I'm going to combine some questions too. So one of the first questions we got, and a lot of folks were asking about the treatment and medications in remediating ME/CFS that were talked about during Megan's preliminary data that was shared. Again, preliminary data that was shared on some of the early access. So talking about that, would anyone like to talk to you a little bit about how this tool can be used in helping answer that question, both for you as an individual and for research at large?
Yeah, maybe Chris can chime in as well, or if you have like a screen share. If you're tracking as an individual, what you can do is you can see which days you have taken a specific treatment, like if you're trialing a new treatment. I know for a lot of us, sometimes the good effects and the bad effects can take a while to manifest. Sometimes they happen quickly, but unfortunately with the good effects, that seems to be rare. And you're overlaying that in your own mind with, okay, well, I took this treatment but I was very active that day, so I felt bad, but was it because of the treatment or was it because of my activity? So you can track all of that within the platform, and you can mark the days that you've taken the specific treatment. And by participating, by doing that, we can, we or collaborators can look at this data, and we can try to look for patterns in this data longitudinally. And then we'll also have more simple survey instruments like the ones that I just saw, so we can get a little bit more information on how people felt about specific treatments, and we'll be able to analyze that together with everything else that people are providing, and hopefully what is a very low effort way for participants to be able to provide this amount of rich data.
Fantastic. Chris, do you want to jump in on that as well, or would love to hear your thoughts?
Yeah, I think that Megan did a great job answering it. So
fantastic. Next question, just moving right along. I'm going to merge two questions together. The first question is, what kind of data is most critical to collect, and what kind of data is hardest to collect? And then speaking of data, for folks who are already in the Solve Together platform, we got a question: does it populate automatically into the new platform? So, so speaking of data specifically, what kind of data is critical? What kind of data is hard? And what kind of data is getting populated over to the new platform if you're in the original platform?
I think both for the critical and the hard data. I mean, I will say once again, pediatrics, it's really difficult to reach out to this community. People are so busy. And when you think about it, it's a relatively short time of life. It's like, oh, we have from 2 to 18, right? That's 16 years, but it would kind of be like saying, oh, well, we're going to enroll like people between the age of 40 and 56. Like it's not a long period of life, and so much happens developmentally, immunologically, neurologically. Like it's very difficult population to reach, and it's so important to study for individuals, for us as a society, for us as a chronic illness community who's looking for information about our diseases. So I think that one for both the critical.
And I'd like to just kind of add to that too, that a lot of clinicians don't realize like some of the symptoms that they're hearing in the pediatric population are actually precursors to some of this. And, many times I heard, well, your daughter's just more aware of her body, or her stomach is just smaller, or, just crazy answers to autonomic issues looking back that she was having. But clinicians just aren't aware of these different things in general. So I think it's really important to put some stats and some words around what are these symptoms and how is it described, and how can we better inform doctors on what these things look like.
I think for the last question as to whether the data automatically populates, the answer is certainly yes. It's ultimately an evolution of the same Solve Together platform. So if you're already in Solve Together, yeah, just continue to participate. We'd love for you to continue to participate.
Fantastic. We got a lot of questions about other apps and collaboration or integration with other apps. We got questions about Visible, about Lumia, about Polar. Are there any intentions to integrate or potential? Can these already integrate? And if so, would they be able to integrate in the future?
So I think I think partially it does depend on the other app and if they allow you to integrate, but many other devices on the market do already integrate with Apple Health and Google Fit and Health Connect. And so I would say a lot of devices, a huge number of devices are already available to be connected to unhide.
So those are the three to check: Apple Fit, Google Connect, and what was the last one?
Sorry, Apple Health,
Apple
Google
Health, sorry.
Fit, or Android Health Connect.
Yeah,
Android Health Connect. Okay.
Google Health. And so most of those apps would have something that feeds into those that could then feed into the unhide, so that we don't have a lot of different apps. It can be kind of streamlined, and it would go through Apple or Google as kind of a main hub.
Exactly.
Fantastic. That was a lot of folks had that question. So hopefully that helped answer some of those folks. One other question on the technical side of this: can the app be active for one user on two phones? Because one parent flagged that their child might use it intermittently with the caregiver. So is that possible?
Currently the app cannot be, but you can always use the web browser to participate as well. So you could use the app for one user and then use the web browser for the other user, for instance. That's how we would probably recommend using it.
Fantastic. And some other interesting questions around the participation for folks outside the United States. And just at this time, it's limited just to folks in the United States. Is that correct? But we're looking into an expansion. I just want to, folks are asking about the potential timeline. We have folks from Canada, from Japan, from a couple of different places who are very interested.
Yeah, that's something we would, it's on our roadmap, but again, funding is always an issue. And right now we're just in need of funding to run the program here in the US. And pending further large grants or foundations that can help, or donors in general, it's something that we don't have an exact time for, and we're going to test out the Spanish piece and see how that goes. And we do get lots of emails asking. We've had Greece and Italy were some very recent ones. So there is definitely interest, but again, funding is always an issue.
Absolutely. Always key to get those resources in place to do it well. I know we're almost out of time, so I'm going to save the biggest possible question for last when you have the least amount of time to answer it. But I'd like to throw this out to the whole panel. Clinical trials. Folks are interested. Are clinical trials available? How does this fit into clinical trials? What is the purpose of the platform when it comes to potentially reducing the cost of clinical trials?
Yeah, one of the reasons I was so excited about this is because this can absolutely be a game changer for a lot of clinical trials that are being developed. If we have somebody who, a collaborator or an outside institution that's running a clinical trial of a new drug or medication at their institution, and they want to do a long-term follow-up through unhide makes it so easy for patients, and researchers will have so much data. They can look at all the validated survey instruments. They can have this objective data that's being collected from wearable devices. There's the optional connection of EHR, and then there's also the symptom tracking data that's in there, and we can help researchers to customize, the cadence of different surveys, and what would be most important for the follow-up in their study as well. But yeah, this was one of the big, I think, still kind of not fully utilized potentials of this platform is in terms of clinical trial outcomes and follow-up, and I really hope that we'll have more collaborators to be able to use this, because it's so much easier for patients than coming in to do these questionnaires. They can just do them from their bedroom, and the data set is so much superior to what you're getting than if someone's answering on the phone, like just checking off a couple of responses. So yeah, I think it has tremendous purpose for clinical research trial outcomes.
That's a great response, Megan. And I think it's also important to note too that if a researcher is looking to collect biospecimens, that can be done through the app as well. We do not have a biobank ourselves, but there's a lot of kits and different resources for those kits out there, and it can all be done and coordinated through the app, as well as the data collected there too. So there's a lot of customization surrounding every aspect.
Here, here. Well, I know we are out of time today, so thank you so much, Christy, Megan, Chris. Thank you for your time. Thank you for joining us. Thank you for your amazing work on this awesome platform. And I'm so excited to see where we go next. I'm so excited to see the rest of the data from what's already underway. And I'm so excited to have Solve's partnership be a collaboration with this amazing project. So with that, I'm going to bid you all adieu. Thank you so much for your time. Thank you for joining us. As always, these webinars are recorded and available on our YouTube channel, and you can see them there. Again, the QR code is on your screen. If you're interested in potentially funding the next big breakthrough, these webinars and the various work we do are thanks to donors like you, and we really appreciate all of your support. So if you would consider a gift to Solve today to enable us to keep doing this fantastic work with amazing partners like BIC, you can scan to donate on your screen right there. And then last but not least, if you want to find out more cool events like this one on social media, you can follow us on Twitter, Facebook, Instagram, YouTube, LinkedIn. We're everywhere, and we're excited to get you all of the information about science, clinical trials, advocacy, and all of the great work that's being produced by so many folks like our guests today. So with that, thank you so much for being part of the Solve family, and we'll see you at the next webinar in a few weeks. Take care, everyone.